It's AJ, about pennies, stacking dollars, spending so much money on the black card, I can't even follow. Alright, fun, interesting fact of the day: Floyd Mayweather beat Canelo Alvarez in a star-studded performance. Like the judge, I scored a 114 just because I wanted to see a rematch. I mean, he had clean shots and so forth, but let's get on to business. This is the part one series of neurology. We're going to start off with neurology and whatever else. I don't know what order the videos will be on, but let's help each other get through the boards. You can go in the comment sections and help one another out. All right, so we're going to start with essential tremor. Essential tremor is a tremor causing fine, rapid tremor of the hands, followed by the head, tongue, limbs, and trunk. Although not having a dangerous sequel, it may be very debilitating. Fremont's line, also referred to as Cogwell effect, is a test that shows whether or not the ulnar nerve has palsy. Don't get Cogwell effect confused with Cogwell rigidity, which is seen in Parkinson's disease. Nevertheless, the test tests for ulnar nerve palsy, and therefore a patient with ulnar nerve palsy will experience difficulty maintaining a hold and will compensate by flexing the flexor pollicis longus, which is a sign diagnosing essential tremor clinically. The flexor pollicis longus is the thumb, so therefore that's why the patient will use it to hold the cup and so forth in a better grip. Essential tremor has immediate onset, while Parkinson's disease has a latent period of several seconds. Essential tremor of the hands occurs when the hands are in use, and in Parkinson's disease it is seen when the hands are at the sides or resting in the lap, therefore decreasing the tremor when the hands are moving in Parkinson's disease. Essential tremor is not associated with other neurological symptoms, while Parkinson's disease is associated with stooped posture, slow movement, and shuffling gait, speech problems other than the tremor, anosmia, and sometimes memory loss. Essential tremor is the most common of many movement disorders. Consider monosynaptic disease, causing tremor and nothing else, more often onsetting in mid to late life, but can be seen during adolescence. Most common sign is the trembling up and down movement of the hands, although the arms, legs, head, and even tongue and voice box, the larynx, can also be affected. Most individuals have tremors in both hands, although tremors may be seen in only one hand and progress to both. Tremors only usually occur during voluntary movements like drinking a glass of water, riding or threading a needle. Therefore, actions requiring fine motor skills can be especially difficult. Fatigue, anxiety, and temperature extremes may make symptoms worse, but tremors usually disappear as sleep or rest. Low doses of alcohol, such as beer or wine, can dramatically decrease the tremor in approximately one-half of the cases. Besides the tremor, there can be mild impairments of balance. There is no diagnosis as definite for essential tremor, but ruling out other disorders along with clinical evaluation is a course of diagnosis. Half of all essential tremor cases occurs due to an autosomal dominant genetic mutation associated with a disorder referred to as benign familial tremor. Clearly identifiable structural changes such as Purkinje cell loss and Lewy bodies have been observed in patients with essential tremor. Changes are not uniform but follow several patterns, such as localizing to the cerebellum itself or collecting to brainstem neurons and synapse directly to the Purkinje cells. Positron emissionary tomography scanning shows certain parts of the brain, including the thalamus, having increased activity in people with essential tremor. Remember, that's positron emissionary tomography, and it's going to show increased uptake in the thalamus with patients with essential tremor. More research is definitely needed with essential tremor, but let's go on to the diagnosis. Essential tremor is a sinusoidal movement. Hyperthyroidism, along with other conditions, can be confused due to the symptoms resembling essential tremor. Essential tremor is a clinical diagnosis. Lab findings are useful to rule out thyroid disease, heavy metal poisoning, and other conditions. Management. Essential tremor may be distressing but not debilitating. Others may find it difficult to work, perform everyday tasks requiring fine motor skills, or doing things that they enjoy. Severe tremors can lead to social withdrawals and isolation. Fortunately, a wide variety of treatments exist that may help. The mainstay of essential tremor treatment is propranolol and primidone. Beta blockers usually used to treat high blood pressure, such as propranolol, may be helpful in tremors in some patients, but due to propranolol causing dizziness, confusion, and memory loss in older adults, it will be better for younger patients to use. Usually the onset of essential tremor is in early adolescence or adolescence, but most commonly in mid to late life. Also avoid in patients with asthma, diabetes, and heart problems. Other medications include anti-seizure medicines such as primidone, which may be effective in patients that did not respond to beta blockers, usually given at lower doses than given in epilepsy, typically at 50 to 700 milligrams per day. Main sides are flu-like symptoms, which usually disappear with a short time. Tranquilizers such as diazepam, Valium, and alprazolam, Xanax, are sometimes used to treat people with tremors worsened by tension or anxiety. Sides include confusion and memory loss. Botulinum toxin type A, Botox injections, can also be useful in treatment of some tremors, especially of the head and voice. Botox injections can improve symptoms for 3 months at a time. When used in hands for hand tremors, Botox sometimes can cause weakness in the fingers. For disabling tremor, surgery may be an option for patients not responding to medications. DBS, deep brain stimulation, is a treatment involving a brain implant device called a thalamic stimulator that may be appropriate if severe tremors are not resolved with medications. If a patient, now I got 3 questions for you guys, all right? Just to remember some key things about essential tremor. If a patient with essential tremor is evaluated on a fluorodeoxyglucose positron emissionary tomography, where would increased uptake be marked on imaging? Would it be the cerebral cortex, the pituitary gland, the cerebellum, or the thalamus? Alright, good job. It is the thalamus. In half of all the essential tremor cases, the mode of inheritance is autosomal dominant or autosomal recessive. Man, you guys are good. It is autosomal dominant. What's one characteristic diagnosis essential tremor? What is one characteristic diagnosis that differentiates and enables you, the future doctor, to consider it to be essential tremor rather than Parkinson's disease? Would it be gait disturbance, female gender, slow onset of several seconds, or would it be head tremor? Man, your future looks bright. It was definitely a tremor in the head. Alright, man. So this video is alright. It's going to get better every time. We're going to work together. We're going to do well. This concludes essential tremor. If you find anything lacking, I will add more. So let me know. Be positive in the comments. Let's work together to do well. I got a finger on my cut today. You see that? I need help clinically with wrapping band-aids. Alright? So you guys can tell me how to do that as well. Alright, take care. And remember, it's AJ. You know, about pennies, stacking dollars, so much money on the black card, I can't even follow. People be opening my doors and shit, trying to see what I'm doing and shit, you know what I mean? Feel me? I'm here stacking dollars, though. I told y'all, man.